Good evening, everyone. My name is Michael Bawuah Owusu, and alongside my partner Olufemi Fadare, we are presenting the Be Well initiative, behavior educators, behavior education, wellness, and a lifestyle for living. Now, imagine this is someone living with a disease that slowly damages their heart, kidneys, and vision, and they don't have the money, access, or support to stop it. That is the reality of many low-income adults living with type 2 diabetes in Arlington, Texas. Today, we will show you not only why this problem matters, but how our program offers a realistic evidence-based solution. Our presentation is structured into three parts. First, we define the problem and who is most affected. Second, we review evidence based programs and theory. Third, we present our program design, the Be Well initiative. Each section builds on the last, just like real problem, just like real public health planning. From the understanding to apply evidence and from applying evidence to building solutions. Defining a problem, type 2 diabetes is a chronic condition where the body cannot effectively use insulin, causing glucose to build up in the bloodstream. Over time, this leads to serious complications affecting multiple organs. Now consider the scale. Over 38 million Americans have diabetes, about 90 to 95% are type 2, and nearly 98 million adults have prediabetes. That means millions are at risk without even knowing it. In Texas, about 11.4% of adults are diagnosed, and rates are even higher in low-income communities. This tells us one thing clearly. This is not just a medical issue, it is a population level public health problem. Talking about the prevalence data, this table shows the burden across different levels. We have the national level already, that's already high. We have the state level, Texas slightly higher, and we have the local low income communities like Arlington, which has the highest risk. This increase is not random. It reflects reduced healthcare access, food insecurity, limited preventive care. So what we are seeing is a pattern driven by environment and inequality, not just individual choices. Talking about the health impacts and contributing factors, type 2 diabetes leads to cardiovascular diseases, a leading cause of death. Also leads to vision loss and kidney failure, long-term disability. It also costs over 400 billion annually in the US. But beyond physical health, there is also emotional distress, depression, reduced quality of life. Now, looking at causes, uh, we have the behavioral that leads to, so we have the behavioral, something like the poor diet and inactivity. We have the socioeconomic uh, cause resulting from like something like the food insecurity and lack of insurance. You have the environmental that can result from limited access to healthy options, and we have the social that can stem from low health literacy and support. These factors are interconnected, and most importantly, they are modifiable. That is one thing that we need to know. Well, to address this issue, we partnered with Mission Arlington. Why did we do that? It serves low-income uninsured populations, provides free healthcare and support services, has over 30 years of community trust. This means we are not creating something new from scratch. We are building within an existing trusted system that makes our program both realistic and sustainable. With the best practice programs, evidence from research, we reviewed three key programs. So the program one, that's the Reach Detroit. We used community health workers, reduced HB1 significantly, uh, and also with the Program 2, that's the social cognitive theory physical activity program. Uh, that was a structured weekly session. Sorry. So evidence-based program. So the social cognitive physical theory activity program. There was a structured weekly sessions, which led to improved weight, blood sugar, and blood pressure. Uh, and the key takeaway here is that it is consistent and it's a theory-based session work. Mm. The program 3, that's the resilience-based DSME. So we combine education with peer support, uh, and this reduced stress and improved diabetes control. And the key takeaway in this was emotional and social support matters. These programs show that education alone is not enough. So support and environment must also change. With a health theory, that's the social cognitive theory. Um, the reason why we use this theory, because this theory explains that behavior is influenced by three interacting factors. That is the individual, their behavior, and their environment. This is called reciprocal determinism. In simple explanation, if someone wants to eat healthy but cannot afford healthy food, knowledge alone will not help. So this SCT allows us to address confidence, that's self-efficacy. Also helps us to address the skills, the behavioral capability, uh, the environment, the environment that have to deal with access and support. And this makes it the best fit for our population. Talking about a healthy people 2030, our program aligns with two healthy people 2030 objectives. That's the D01, and this reduced progression from pre-diabetes to diabetes. And in D06, increased access to diabetes education. These objectives ensure our program is not only local, but also aligned with national public health priorities. Bawuah initiative includes four interventions, and the first one is the education sessions, which help improve knowledge and skills. The peer support groups that help to build confidence and motivation. The food access support, which addressed nutrition barriers, and physical activity sessions, which encourage consistent exercise. Each company directly targets a factor we identified earlier. So the program is not just random, it is strategically designed from the problem backward. Well, the next slide is going to be handled by my partner, uh, Olufemi Fadare. Thank you.
Thank you, Michael. Yeah, in this slide, the Bawuah Initiative Logic Model is focused on logic model and evaluation. So our program follows a clear structure. Follow input, activities, outcomes, and we will evaluate success through, and is focused on the participation and attendance, changes in knowledge and behavior, clinical outcome like HbA1c and BMI. So we can see that in the table in the slide, the input activities output, the short-term outcome. The next slide. This slide talks about evaluation plan, as I've mentioned. So, and the evaluation plan focus on the process, the impact, and the summative. So the focus on the program reach, the program delivery, and the knowledge and self-efficacy, the behavior change, and the overall effectiveness. So the program ensure that everything is measurable and effective. Lastly, Next slide. Talking about the conclusion and implementation consideration. From the peer review study, it has been established that diabetes is a major issue in low-income communities. It affects them disproportionately, and evidence shows that education, support, and environmental matter is more realistic and more productive in intervention. So type 2 diabetes is a disproportionate burden to the low-income adults. And based on this, the Be Well initiative combine all three into one program to yield effective results. And if implemented, this program can reduce diabetes risk, it can improve quality of life, and reduce health disparity. Next. So this is not just a proposal, it is a practical evidence-based solution. Thank you. And we welcome your question. If there is any question, we welcome your question. Thank you.
Thank you.